Good morning. My name is Richard Sloma. Welcome to today's New York State Archives presentation of Keeping Up with COVID-19, Maintaining Your Pandemic Records. Today's presenters are Jennifer O'Neill and Michael Martin. Jennifer is the New York State Archives Head of Scheduling and State Agency Services. Michael is Records Advisory Officer, or RAO, for towns in New York State. This session is being recorded and will be available for future viewing. If you have questions, please type them in the chat box to the right side of your screen, and we will answer them at the end of the presentation. And now I will turn the presentation over to Jennifer.
Great. Thank you, Rich, and good morning to everyone. So 3 years ago, Michael and I presented a version of this webinar. Some of you may have attended that or listened to it. We thought that this would be a good opportunity to look back at the guidance we provided and also provide you with any updates. As you are all well aware, 5 years ago, state agencies and local governments were faced with an incredible challenge, continuing to provide essential services to the public during a global pandemic. Governments had to really pivot quickly to the demand for increased digitization of services and records by both the staff and the public, for a hybrid workplace with some staff telecommuting, and for communication with colleagues and the public remotely. These needs required changes to your organizational work culture, your interactions with the public, and your technology and communications infrastructure. The response to the pandemic also highlighted some challenges and opportunities regarding managing records. And this morning, Michael and I are going to discuss these challenges and opportunities along with retention requirements for records created during this unprecedented time. So today we're going to cover a number of topics. First, we're going to talk about what the New York State Archives has been doing to ensure the proper retention, management, and preservation of records documenting the pandemic by both state agencies and local governments. Michael's going to talk about how we deal with records that were created remotely, and talk about the challenges that creating records remotely can bring. Then next, I'll get into talking about records retention and disposition, including records that were created documenting the pandemic that might have potential historical value, and those records that are likely not to have any or limited value. Michael is then going to talk about legal considerations for keeping these records, focusing on what federal regulations require. He's also going to talk about some issues of access, particularly confidentiality of some records, and making available recordings of meetings online. Finally, we'll wrap things up with some concluding remarks, and there should be some time left over to answer any questions you have. So please feel free to put questions in the chat throughout our presentation today. So let's first talk about what the State Archives has been doing in terms of COVID records. So we've provided guidance to state agencies and local governments on identifying historical records that document government's response to the pandemic. We've helped identify those records that will likely have the most potential for future researchers. Any historical records that have been identified will need to be kept permanently. So we're going to go into more detail and give some examples about historical records that you may have maintained and that you should consider as having some historical value. We've also been working with state agencies and local governments to develop retention schedules for COVID-related records. We've worked closely with state agencies to develop some agency-specific schedules for records that they may have created and maintained that are unique to their own functions. We did discover that there were some gaps in our general retention schedules that needed filling. So we did make some updates to the local government, the LGS1 schedule, and we also added memos to both the LGS1 and the state general schedule at the beginning to address any records retention requirements that weren't already addressed, or maybe there were cases where the retention requirements differed for COVID-related records. So those are in the introduction to the general schedules as memos. We've developed resources and tools to help governments manage remote records as well as social media records. Just keep in mind that even though records may exist in digital format and are not physically stored in your office, doesn't mean that they aren't government records. They need to be properly managed too. So another thing that we did, and this is for state agencies, is in the winter of 2021, we sent a letter to key state agencies that were involved in the pandemic response. And identified some potential historical records and encouraged them to transfer records to us. We did get a pretty good response from agencies. There are some agencies that we haven't yet heard from. So for those agencies, I put in a plug, and I would strongly encourage you to transfer any archival records that you have to us. We also captured key state agency websites through our web crawl initiative, um, and those are currently available through the State Archives website. All right, so I'm going to turn it over to Michael.
Thank you so much, Jennifer. Okay, excellent. All right, so our next topic is focusing on remote work or working from home, telecommuting, whatever you want to call it. No matter what, it really was a big adjustment that everyone had to adapt to pretty quickly in 2020. So not surprisingly, there's been a lot of changes since 2020, we wanted to take a quick look at some of these changes, some with long-lasting impacts, others not so much. So the big one is this push to use electronic records. There really was a strong push, incentive, whatever word you want to use electronic records. All of a sudden, there were really no other options for people in 2020. Everyone had to work from home at least part of the time. All the meetings had to be conducted remotely, public and staff alike. People expected their records to be accessible even when the office was closed. There was an expectation, not surprisingly, that functions of a government or agency would continue no matter what. So the only way to connect to the public was electronically or digitally. There was this really huge rush to implement new technology. And really, we all had to kind of learn how to use these things on the fly. There was little training provided. Okay, so we all had to kind of start dealing with these different applications to meet and talk with family, friends, and coworkers. The big difference is when it came to work in particular, there was really no formalized training provided at first. It became very clear when we all kind of stumbled around trying to, use these new applications and making the same mistakes. Hitting mutes, not, hitting the camera at the wrong time, all of that. It became very obvious that we were all struggling and moving along, but that there had been no formalized training. And, we were all kind of struggling at the same time. The other thing that really became a big deal was this use of cloud technology. Everybody was kind of pushed to move everything to the all-powerful cloud, where things are stored off-site on separate servers, usually with a vendor, but not always. This helped, get through the idea that records could be accessible to everyone at the same time. It really seemed like a godsend. But how exactly would people make this happen? Would you be able to easily move everything at once, or would it have to be in fits and starts? And once a single department or office was available online, then staff and public alike would definitely want that convenience and security for all the other records. While some organizations, local government, state agencies were well on their way and comfortable with these applications that use the cloud to store data, not everyone was. And then there was a problem of how best to work with the vendors that had these systems to set up and maintain files. Talk about this in a minute, but those were not really designed for records management or preservation. Tools like Teams or Zoom, which we all became very familiar with, ensure that we could hear and work with each other. They were not designed to maintain recordings over the long term. And this really led to some challenges and some changes, because with changes in the open meetings law, which I'm going to discuss later on, suddenly those recordings had to be kept and maintained. How could Zoom and team meetings be recorded and saved so the public could view them later? These are the kind of things that we've been kind of dealing with since then. So the challenges with remote work, still kind of the same. There are plenty of challenges associated with people working from home, whether they're doing it for 10%, 30%, 50% of the time, what have you. People are still working from home, and these issues still come up. The whole idea of the use of personal devices, okay? There were plenty of devices that people had on their own, but if they're working on their own device and they're creating official records, then that can become a problem, right? How are people maintaining these records? Are these records getting to where they need to be? All those questions. And then the other issue of, are people able to access the records? Records that your staff needs to perform their jobs will be available out of office, but you need to have the right applications. You need to have the right level of security or administrative level. So this, you can still run into some problems as well. And the big one, the one we've seen over and over, is this lack of a disaster or business continuity plan. Because this is a huge one and it's still a challenge. Even if an organization had a plan, had a disaster plan, there was no way this plan would consider, what the pandemic brought about of long-term closures and everything else. So at this point, we've dealt with the pandemic, we've dealt with office closures and floods and fires and everything that nature and man can throw at us, but some places still don't have a disaster plan. They don't know how any of their information is backed up or how that information can be shared with the public. So it's all well and good to know that it's in the cloud, but how do you ensure that you're going to have access to others? All of this, is something people are still kind of working on today. So working with managing remote records, okay? So when we're talking about records, there's a very specific definition, okay? Records are anything that's created or received in the normal course of business. So it doesn't matter whether you're on a device, working with your personal email accounts, you really shouldn't be using your own email account to conduct business. You should be using your official account no matter where you are, whether you're working at the office or home. If it's being created in the normal course of business, and it affects your organization or agency, it is a record. So you gotta make sure it's being addressed like you would any other record. You want to make sure that you're not leaving these records at home. So when you're actually in the office, that information is being transferred. You want to make sure people are not leaving things behind or leaving things on devices that they shouldn't be, that sort of thing. Because it makes it really difficult when you start thinking about in terms of disposition of, have you identified where all the records are? You want to make sure that you establish some kind of filing system. right? Because you need to make sure people can identify where the records are, whether you're using Office 365 and OneDrive or Google Workplace and Workspace and Drive or Dropbox, whatever you may use. You need to make sure the records are stored safely, but that people have quick and easy access. And people tend to have their own idiosyncratic filing systems. And we've seen that with paper records, and you can certainly see it if you happen to look into any of your folders or maybe your desktop. People have their own way of organizing things. It is incredibly helpful to create some kind of standardization, some kind of policy, some kind of logical set of folders and metadata file names that are going to help you know where to store and retrieve records. And we'll actually have an example on the next slide. And then I'll always remember privacy. Remember those considerations when you're storing records. You know, avoid saving records with sensitive information on devices that are not work devices, that sort of thing, or if anything is saved, that you are disposing of it correctly. Okay. So here's that file plan I was talking about for working with remote records or any kind of record storage. If you're not familiar with a good way to organize, then here's a quick run through for the plans for folders that you can use for your cloud storage, for example. So in this case, we start off with the function, physical, or you can start up with a department or an office, doesn't matter. That high level so people know where they're looking, and then you drill down to the specific activity. In this case, we're talking payroll. And then you have another folder that has the actual files, okay? And that contains the records of files. In this case, it's each payroll register, the end of the year. And you can see that somebody has included each year for the end of the year payroll. And they also included something we actually recommend on the folder is the retention period as well. So in this case, those end of the year payroll are kept for 55 years. So people know that, after 55 years, it's time to take a look, but also 55 years means you're going to be keeping this a pretty long time. And some other issues about just working with those remote records, okay? You want to avoid creating multiple copies. Now, it's not the easiest thing in the world because you have people sharing information back and forth. If you're sharing things on like a drive or you're sharing things via email, you want to make sure that you're addressing what you have about making sure that you only have one official copy and the others can be disposed of when they're no longer needed. You want to purge the rot, the redundant, the obsolete, the trivial. You want to make sure that those are gotten rid of in a timely manner. Make sure you're identifying them and you're not deleting something that you should keep. Dispose of the records according to the retention periods, okay? It doesn't matter, where a record is stored. You want to make sure that you're getting rid of it in a timely fashion. And once it's met its retention period, that it can be disposed of, even if it's stored in a cloud storage or something else. And you also have to remember, particularly with the pandemic, some of those COVID records may have historical value. They may have historical or research value well beyond what they normally would be. I mean, we know we have to keep some things according to open meetings law, but maybe those first meetings where you're dealing with policies and procedures, they may have additional historical value as well. And one thing we wanted to make sure everybody understood, is that you need to have some kind of policies for all of these different files that you're working with, okay? So we want to make sure that everybody has an understanding of what exactly it means. Now, when this first came in, there wasn't a lot of guidance. We have since been able to provide some in terms of social media records, what to do with your team and Zoom recordings, that sort of thing. You can always reach out to us at the State Archives so we can provide some guidance for you. No matter what it is, we can definitely help you out with it. Just have just to have an idea of what your problem is and we can help. But the big thing to remember is that if you don't have policies and procedures, right? If you don't have policies and procedures, you are going to have issues. there is going to definitely be some confusion. So you want to make sure that part of your policy and procedures are people replying retention based on the content and not the format. Jennifer mentioned this, earlier, but remember, there's no single item on the retention schedule for any of these records, for social media or anything like that. It all depends on the content of the information, not the format. So it doesn't matter whether it's on Facebook or YouTube or whatever. If it's correspondence, you keep it as long as you would an email or a written letter. Same thing. You need to think about storage, okay? We suggest you think about where you're going to store these records, particularly video recordings of meetings. They're large files, and the retention, and long-term retention may be needed in some cases. So where will they be stored so that they're still going to be accessible to the public and not cause you to fill up your own servers and cloud storage? Everybody says digital storage is cheap. That's true, but it's not free, and that's only true until you push that limit. I'm sure all of us are getting emails right now from Gmail about how you're 98% full. So you need to think about that storage. The other thing is YouTube is not always a solution. You may think YouTube is a great solution for access, but it may not ultimately be good for keeping a record you need to maintain. So if you need to keep a record for its full retention period, you want to make sure that you have a copy that you can easily duplicate and have ownership of, which is not true when you simply upload something to YouTube. At this point, I'm going to hand it over to Jennifer. Wait.
Great, thanks, Michael. So we're gonna take a look at some retention and disposition requirements. And first, we're going to start out with taking a look at records that might have potential historical value. So as we've mentioned, and as you know, the pandemic had a significant impact on government operations. Governments obviously played an important role in implementing public health measures and providing recovery resources and money to communities and businesses. Because of this, your government has documentation of its response, and that documentation has potential historical value. The state archives is authorized to identify the official records of state agencies and local governments that possess sufficient historical value to warrant their continued preservation, and that's detailed in the Arts and Cultural Affairs Law. We are very careful in identifying records that have historical value because it has cost implications on local governments, state agencies, and on ourselves, since we're responsible for preservation of archival state agency records. We identified some categories of records that may have potential value, historical value in terms of COVID documentation records. The list that I'm going to share with you it's not comprehensive, but we chose ones that were likely to be found across various types of government entities. These will hopefully provide you with some guidance in terms of appraising and evaluating your own records, and hopefully ensure that adequate preservation of records that document the pandemic are preserved and made available in the future. So you'll also, one thing that I should have noted is that even though the official state disaster emergency lasted from March 7th, 2020 to June 24th, 2021, the documentation that you might want to consider could be on either side of that. So efforts that your government made to ramp up for COVID, or you probably continued to provide services to assist people in terms of responding to COVID, even after the emergency declaration was lifted in 2021. So don't necessarily look at that really narrow window of when the state disaster emergency was in effect. And also, I should mention that some of these records that you'll see in these categories are already marked as having historical value in retention schedules. I just want to emphasize them so you're aware that these are series that are likely going to contain COVID related records. You'll also notice that there are records listed here that are on the retention schedules as not being archival. So they can be destroyed after a period of time. But we're suggesting here that you might want to evaluate those records because they might contain some records that document important COVID activities that might make you want to uh, consider keeping them longer than you normally would. So a really important source of pandemic information are the records of the chief executive and senior leadership. So these are commissioners of state agencies and heads of local government entities like your mayor or supervisor. These people are usually involved in the decision and policy making for the government, so that makes them really rich sources of COVID response documentation. So for example, we are part of the state education department and we obtained the commissioner's subject files for the state education department. And those are good documentation of SED's COVID response. Also, another set of normally historically valuable records are public meeting and hearing records. And this is another source of major policy decisions. So please consider those as for preservation. This non-public or internal meeting records item, these records are normally not considered archival, so this is an example of where you might want to evaluate some of these records to see if they might have some good documentation in them. And these would probably be like entities that were specifically tasked with providing response relating to COVID. We're not suggesting that you keep records that are like internal staff meeting records. Those likely aren't going to have historical value. Here's some other records that may have historical value. So council's records, these are legal opinions and decisions, or they may relate to the development of laws and regulations. Also selected records of your public relations office. These would be press releases and publications. These are normally good sources of summaries of government positions and the response to the pandemic. So, for example, from the governor's office, we have received photographs and video recordings, including Governor Cuomo's daily press conferences that were widely watched nationally. So those are available in our archival collections, and those are good documentation of the state's pandemic response. If you have any administrative policies, plans, or studies that relate to COVID. These would address operations or issues of critical functions or address issues of public visibility. We received quite a number of these from agencies. So the Office for Children and Family Services, they shared with us policies that they had provided to entities that they license and oversee. From the State Education Department, we received the Chief Financial Officer's weekly reports that were sent out to schools. And from the Office for People with Developmental Disabilities, they shared with us guidance that they had provided to certified providers, state-operated facilities, and programs, and their own staff. So those are really rich sources of documentation. Obviously, public health response records are going to be really important historical records. You probably will only want to keep summary records of COVID-19 treatment, testing, and vaccination um, uh, activities. You're not going to want to keep the individual, you don't want individual tests being kept. For instance, one example from the Office of Mental Health, they recently transferred to the state archives the final report from Project Hope. And Project Hope was their crisis counseling service that they provided during COVID to people who needed assistance during the pandemic. And then finally, you may also want to consider keeping records that document emergency response and public safety, including responses to health threats to communities or health hazards in public facilities. And those are obviously related to COVID. Another set of records that you might want to consider that you wouldn't normally consider historical are program level correspondence and subject files. And these would be ones that document significant policy and decision making or legal decisions related to the government response to the pandemic. But these are going to be probably very few because you're going to find the bulk of your policy and decision making and legal records elsewhere, like in your executive and legal departments. Summary documentation of labor management relations, including accommodations implemented as a result of the pandemic. Those you may want to consider historical. If you have summaries of expenditures, annual financial reports, or summaries of COVID-related grants you may have received or that you may have dispersed to others. Again, you'll want to just keep a summary of these records, not the detailed financial records that relate to these grants. And we're going to talk more about those financial records in just a bit. So obviously not all COVID-related records are going to have enduring historical value. In fact, the vast majority are going to have limited fiscal, legal, and administrative value and can be destroyed after the retention period has been satisfied. So we're going to talk about those records that have a limited historical value. So this is a set of records that we've gotten a lot of questions about. So these are health screening records. And these are those records, if you remember that during the pandemic, if you went into the office, employees had to fill out health questionnaires or do temperature checks. And it would cover any employees, students, visitors, contractors, anyone coming into your facility. So we have scheduled those under the local government um, results of health screening item in the LGS 1. And for state agencies, this retention schedule item can be found in the introductory memo to the general schedule. And it's a very short retention period. We worked this out with the State Department of Health and came to a retention period of 30 days. So unless you are still requiring that these records be created, all of these can be destroyed. So that should free up a lot of space if for some reason you still are storing these records. So one of the federal programs that had an impact on governments was the Families First Coronavirus Relief Act. And this was federal legislation that required that certain employers, and basically every public employer, to provide their employees with paid sick leave or expanded family and medical leave for specified reasons related to COVID-19. And this applies to a very limited period of time to leave requests that date between April 2nd, 2020 and December 31st, 2020. And the federal government regulations indicate that these records need only be maintained for 4 years. And this would include both approved and denied requests. So all of these can be destroyed in just a matter of days. So again, if you still have these around, you'll be able to destroy all of these very soon. So the records on this slide are going to relate to county public health department records. And these you'll notice from this slide all have retention schedules, retention periods that haven't yet been met. Some of them are 6 years or age 21 or 7 years and age 21. For the vaccine distribution and usage records, there's a variety of different retention periods associated with them. With the one with the longest retention period is 25 years. So you're going to need to continue to hold on to these records for a little longer, but take a look at the retention schedule to see exactly how long you need to keep them. Another important federal COVID-related program was the Coronavirus Aid, Relief, and Economic Security, or CARES Act. And one of the components of that was the Coronavirus Relief Fund. And through this fund, the federal government provided payments to state, local, and tribal governments seeking relief from expenses related to COVID. So these would be expenses that were incurred from March 1st, 2020 to December 31st of 2021. And the federal government issued guidance saying that all CARES Act grant documentation needed to be retained for 5 years after final payment. They also advise that these records be retained for that period of time to support compliance with the law. And most of these records, as you can imagine, since it involves disbursement of funds, is going to be financial records. And as you know, financial records normally need to be kept for 6 years. So for most of these records, you're going to need to keep these until 2026 and possibly beyond that. Um, so you're going to still need to hold on to these records, even beyond the 5-year federal retention period. So you really need to follow the 6-year retention period for fiscal records. All right, I'm going to turn it back over to Michael.
Okay, thank you very much, Jennifer. So now we need to think about some records access considerations when it comes to record changes, again, brought by COVID. First things first, what is confidential? So when it came to COVID, these records were confidential, and guess what? They still are. You might come across some of these from time to time. If the record's related to HIPAA, the Health Insurance Portability and Accountability Act, my understanding is that HIPAA applies only to the covered entities and not employer records collected by most employers. So even if a state agency or local government is a covered entity as defined by HIPAA. So while the results of those checks you may have kept, HIPAA does not necessarily apply to the COVID-19 information that a government collects from employees or used to collect, as the case may be. Then these Americans with Disabilities Act or the ADA, those records are confidential. The New York State Public Health Law, patient information cannot be disclosed except to those noted in law. This would cover New York State Department of Health or county departments of health or any kind of local government healthcare facility. And then we're also talking about New York State mental hygiene law. So that would cover records of any facilities licensed or operated by the Office of Mental Health or the OPWDD. So that's patient information that cannot be disclosed except for those exceptions noted in law. And then if you're a school, you're dealing with FERPA, the Family Educational Rights and Privacy Act. So it doesn't necessarily, you want to make sure that their records are being protected as well if they were under the COVID time period. Okay. So the big question, the big change that really was brought about was the open meetings law. So the open meetings law stated state agencies and local governments are considered public bodies. And as public bodies, their meetings for the public must be able to be recorded because the public has to be able to attend or view these meetings. So if people need to be able to attend or view the meetings, particularly during COVID, and they couldn't attend, they had to be able to view the recording. And that's really what the change brought, was the change in how the recordings would be maintained and how long they needed to be maintained. So part of that change is that previously we were always kind of, according to the retention schedule and everything else, the understanding is that the recordings were only kept as long as until the minutes were accepted or a transcription could be made from the recordings. Well, that changed in the spring of 2020 as part of the open meetings law. It explicitly stated that these bodies, the state agencies and local governments, had to keep their recordings and make them accessible for at least for 5 years. And this meant that people suddenly had to maintain those recordings when they simply had not done so in the past. And when people would ask us, well, what happens if we just put them on YouTube? We'd say, that's fine, because that ensures accessibility, but because you're basically handing something over to a third-party vendor, you don't necessarily have control over it. And we always recommend, whenever possible, that you have control over the record that you are supposed to maintain legally. And as part of open meetings law, people had to maintain these recordings. Now, people thought, okay, this might be, this is something that might kind of disappear after the pandemic and the emergency was officially over. Well, it was actually renewed in July of 2024. So people had to still maintain those recordings for 5 years. What we do know is part of that renewal made it very explicit that on July 1st, 2026, this law would be repealed. So those records of the recordings for public meetings that people need to attend or view, according to the open meetings law, those recordings have to be kept until July 1st, 2026. I have a link here for more information about the open meetings law, which Rich, I'd hope if you'd share that with everybody via chat, that'd be great. But it's also on the slide. But the understanding is that when this law is repealed, then the original retention of the, 4 months after the meeting minutes are accepted or transcription is made, it will then revert to that. And so I hope that's clear. That's a major change, and it's something that we have been talking with people about a lot over the last few years. So now we want to talk about some wrapping up, some concluding remarks. We want to make sure, that there's some takeaways that everybody has. Okay, so cloud-based solutions. Yes, there are cloud-based solutions for all your records, not just COVID, right? But these solutions have their own limitations and pitfalls. Make sure you have a clear contract with your vendor about ownership of files, as well as how the files be maintained. Finally, make sure you know how to get your files out of the system if you wish to change vendors at any point. Know the cost associated with this, and know if have an understanding, are these files going to be changed? Sometimes, people have had metadata and other identifying information stripped. You want to make sure that that does not happen, and that should be explicit in your contract. You want to make sure you have policies and procedures when adapting all this new technology, all these new platforms and applications. These toys and the tools are great, but you need to have some kind of written policies and procedures for them. People need to know how to use them, and more importantly, sometimes how not to use them. Having something written down prevents problems and confusion later on. Somebody, there's no plausible deniability. Someone can say, oh, I didn't know that. I didn't realize I couldn't put that on Facebook. Well, policies and procedures makes it clear what is allowed and what is not. Update your disaster and business continuity plans. We can't say that enough. You want to make sure that you've updated your plan, and it includes information about what records you have, what records you can are maintained as backups, where they are located, and how they can quickly be made accessible so you can start functioning again. Big one, health screenings are kept for 30 days. Jennifer made that very clear. If you have any of those kicking around, she also made it clear you don't need to keep them anymore. This is great news because we still have people asking us on a regular basis, do we have to keep these? Usually it's because some kind of administration is turned over and nobody got rid of them previously. So if you have any of those, they can go. CARES Act records must be kept till 2025 or later. As Jennifer mentioned, we're getting close, but not quite there. Open meetings law will expire in July 1st of 2026. So even though we thought it might end, nope, it's going to expire on July 2026. Right, and I think, yep, that is what we have. So this is a great time for people to ask us any questions that may have. And Rich, can you go over some of those if anybody shared them in chat?
Sure, Michael. Yes, we have a number of questions here. I'll go ahead and we'll tackle these first. Early on, Rob asked a couple questions. If an agency COVID record was transferred to its ITS electronic system, is there still a need for the agency to maintain that record, or does the ITS system act as probably the book of record, he says here, but does it act as the record?
I can take that question. So I'm not sure exactly what set of records that you're referring to, but generally ITS has some sort of agreement with the agency whose system it's hosting. So I would look at whatever the agreement is. Usually, if it's an agency specific system, the agency would be responsible for the records maintained in the system, as ITS would just simply be hosting it. If you're referring to like the COVID like health screening records application, I think there might have been some other related COVID ones that ITS and the Department of Health were responsible for. I believe, and I'm I'm trying to dig back in my memory. I think we worked with the Department of Health to come up with a schedule so that basically the responsibility for retention and disposition of those records was, you know, the responsibility of Department of Health. But don't quote me on that. If you want to provide a more specific, more specificity to your question, please
Jennifer, I
feel
was
free
just
to
going
do so.
to add, Rob did say those were vaccination records.
Okay. Yeah, I believe that Department of Health took responsibility for the retention disposition of those.
Okay. And we did have a couple of questions about retention, related to retention, which I think you covered in the health screenings, which are to be kept for 30 days, uh, about asking about staff vaccination surveys, and another question. Yeah, I think that was it too.
Yeah, I saw that question, and I don't know if the person was referring to like copies of employee vaccination cards or some sort of other proof that the government would have required of employees. If it's like individual employee proofs of vaccination, those would be held within the employee's medical records. So for local governments, just because I have that one pulled up right now, that would be LGS 1 item 662. Um,
Okay. And Ellen asked a question here. A few she had a little clarification here too as well about meetings, the recording of meetings. She asked, do recordings of meetings need to be publicly available, for example, on YouTube, or available on request? Or what if notes or transcripts are not made? And what about meetings that are not covered by the open meetings law?
I'll give that a try. So in terms of the recordings, according to the open meetings law, the recordings have to be made available. Many people do it via YouTube because it's the easiest way for them to do it. But you have to make it available to the public. You can make it available on YouTube, you can make it available on your website, whatever way you may do that. But according to the law, you have to make it available some way. In terms of transcripts or notes, usually if you put something up on YouTube per se, it will make some kind of transcript for you. It's not always the best, but it will at least make one. Usually if you're going to put something up on your website, particularly, state agency and whatnot, you need to make it accessible as well. So there, in theory, should be some kind of transcription made as well. For meetings that are not covered by the open meeting law, I would think you don't necessarily need to keep a recording, that the minutes would certainly suffice, because the open meetings law made it very particular about which ones are available to the public and which ones are not.
and just to add to what Michael said, I believe open meetings law requires that minutes be or a transcript be made of a public meeting that's subject to the open meetings law.
Okay. Also, just Rob asked early on here, when is the next iteration of the retention schedule being implemented?
So I believe that Rob must be from a state agency because he asked about ITS. So he's referring to the state agency general retention schedule. Um, we've been hoping to put out a revised version for the past couple of years, and we just haven't had the staff resources to do so. So we're hoping this year, um, but if we need to make updates before then, look to the PDF version of the general schedule online. We put memos at the beginning of the PDF file for any updates, and we'll also send out updates via our monthly agency newsletter. So if you're not a newsletter recipient, let me know and we can add you.
Okay, I have a question here from Ellen on the subject of vaccinations and tests. Well, she asks, what about websites that reported on the numbers within the different workplace areas? These websites quickly disappeared.
Well, hopefully they were captured by our web crawl that we did during the pandemic. I forget exactly when we did the web crawl, but hopefully it captured it. It was pretty inclusive of state agencies that and their various websites for those key state agencies involved in the COVID response. But Ellen, if you want to share with me some specific examples, that would be great, and we can look into that.
I just wanted to add that we're very quickly approaching our time here, and I did paste in some additional contact information for anyone who has additional questions. If they're from a state agency, they can contact New York State Archives State Agency Records Management Advisory Staff by clicking on that link. Or for local governments, you can also go to the New York State Archives website uh, and click on the Contact Us tab, and you will find the various records advisory officers for the different types of governments that you can contact. And other than that, oh, Ellen just did just say she's with CUNY, so just for Jennifer's benefit there. And having said that, any concluding comments, Jennifer or Michael?
Just want to say thanks for everybody for listening to us and giving us your questions. We know that people still run into these records from time to time because we get those questions, and we hope that this has been helpful.
And ditto what Michael just said. Thank you, everyone.
Thanks, everyone. And the recording should be available hopefully by the end of the week. Goodbye.